Well, Happy New Year, everyone. It's just a pleasure, and I'm a little bit kind of shocked that to have this opportunity to talk about the new things. That's when Dr. Wilsey talked to me back in last year, then want me to talk about the interstitiums, like newly discovered like in the Western field, and happily that's it's the like 1,000 years ago the Chinese medicines have the similar things. Well, and she's enjoyed her vacations. I just came back from Asia, and it's a pleasure vacations. Now we're gonna turn into the interesting things um about the interstitiums, and let's trace back to the ancient ways. So like this PowerPoints inside, you might have some things that more like traditional Chinese medicines concepts, or like the terminologies that you might not understand, but it is okay. It's just kind of give you guys a little bit points of view or from the Chinese medicine sides, and about what is similar things, similar concept about the interstitiums. So we all know about the the structure and definitions is that is interstitium's role is in homeostasis, that it plays a critical role in maintaining the homeostasis by regulating the exchange of nutrients, waste, and the signaling molecules between the blood and cells, that's supporting the cellular functions and overall physiology's balance. That's just the definitions. So key feature and locations in the body that in the stitiums serve as a vital conduits for intercells communications, nutrient exchange, influencing tissues, hydrations, immune response, then the overall physiology's homeostasis, thereby playing crucial role in both health and disease stasis. I think modern research has been seeing that the cancer, like that the mutations or cancer treatments or cancers that spread is more related to the inter interstitiums, that so that's maybe explain why of that. And the per uh, proposed functions of the role in the disease mechanisms, the interstitiums is increasingly recognized for potential environments, various disease mechanisms, particularly cancer, right? I just say that. And it may facilitate the movement of cancer cells like through its fluids spaces, or therefore influencing tumor progressings and offering new venues for targeting therapeutical strategies. So important ones are in fluid dynamics and immune response. So that first, the the fluids that hydraulic pressure is essential for nutrients delivery and waste removal. Maintaining tissues health and disruptions in its this fluid balance can lead to the conditions like edemas, highlighting the interstitium's critical role in physicals and homeostasis overall tissue functions. Immune cells navigations, the interstitium facilitates immune cells migrations through its structured environments, allow for effect immune response. The presence of a signaling molecules with the uh, within the interstitial fluid direct immune cells to sites of infections, enhancing their abilities to respond to pathogens and maintain immune overall. So that is the basic of like how what's the like they found out the like in interstitiums that it's all about, and that is like quite pretty new in the development. But also like we can talk about is more on the is on the like traditional Chinese medicine side. Like thousands of years ago, when the Chinese medicine theory structured, and they have a similar like organs, or it's just basic as a concept. It's not we doesn't have the like exact organs like like hearts, like lungs, but in Chinese medicines it do equivalence to a triple warmer concept, right? It's like triples means like three. So in the like Chinese medicines, we are calling this as a san jiao. San is three, and jiao we can call it warmer. So it's a triple triple warmer. So in the physiology regulatory systems, the san jiao function as regulating the systems rather than distinct organs, coordinating the body energy and fluid dynamics across its three burners for optimal health. So later on, I will explain more what does the sun jiao do. Each jiao, we call it the upper, middle, and lower. So that each different part sections like in charge different functions and helping the bodies how that uh, body function as a holistic way. Okay, so interconnected organ systems, each burner of the sanjiao corresponds to specific organs systems facilitating the harmonious interactions necessary for maintaining the homeostasis and supporting overall body functions. So holistic health perspective. The Sanjiaos embody a holistic view of health in traditional medicines, enhancing balance and integrations of physiological, and energetical process within the body. So, the Sanjiao, this is actually pictures that we can see is developing uh, like thousands of years ago. That you can see that upper and middle and lower. So as a uh, like upper jiao, we call it shang jiao. Shang is up, located in the chest area, and it's includes the heart and the lung, and it is described as being like a mist. It's responsible for respirations and distributing the protective qi. The concept of the protective qi in Chinese medicine, it's about like the immune systems, but it's more like like in the old days, like 1,000 years ago, how they know we have like immunities or like they just kind of defense or protective, like helping the bodies not getting sick. That's why they all call it. It's very interesting. In the old days, they called it the pathogens as the evil. They call it the evil chi or evil pathogens. So then they has you gotta prevent it. So they call it protective chi. That's the in the energies the the immune systems. So middle jiao is the zhong is the middle. It situates the upper abdomen that it encompasses the spleen and the stomach. The region is crucial for digestions and the transformations of the food and fluids. So that's like more like digest systems that in the Chinese medicines, this is the core of everything, the energy like produce, the processings that like what we eat into it, and then how they transfer or transform the food into like the energies that body can use. Like in the old days, no one knows about like glucose change, like all transfer into like ATPs and become energy to the like so cells can use. But this is that like like the middle gel, they're using the middle gels, kind of like a picture like you food into it, and then how they just like digest and transform the food into the good nourished energies, and then transport it to the whole body. So that's the middle jiao, that you know, like zhong jiao. So lower jiaos, which is that we in the earlier the pictures that we see is like almost the lower is in found in the lower abdomen, that it involves the kidneys and bladders and intestines. So this is like kind of compared. This is a drainage ditch that manage the body's water metabolisms and eliminates the process. So back to this pictures. So this is like the sun gels that they don't have exactly organs, but it's more like a systems to connecting the whole bodies of like like processings like from food intake, from the air we breathe in, that's to kind of supply the whole body's like how to make the body functions, right? So in the betweens, like how they connect to each other is it is just like through the in Chinese medicines we call this like the qi function. So qi like from like uh here to there, like you transform into it. So I think it's like this is like pretty like hard to imagine it, but it's like for like um modern science, like our food intake into it, it's when they digest how they become like the like energies to the organs that just like the old days Chinese medicines, the expert, they just like okay, the qi, like putting the energies so you can make the the organs work, that make the lung has functions, so we can like breathe, make the heart pumping hard, that so we can like blood circulations, so and then stomach and the um spleens, that is more that we get energy so we can process the food and the fluids and into the waste, that you can see that the kidney, the um the bladders, the intestines, that just in charging the all that. So the key idea is make the triple burner, the sanjiao, the three burners that harmonize each other, and each like in charge of its own functions, and make it like make it all like functioning right, then there's no disease happened. But that is the old days, that the traditional Chinese medicines, they think that's a simple concept. But like back to like nowadays, like it's maybe this will leading to the uh like another way jump out of the box to things, and why we bring it back. The cancers is like how the cancer will produce or mutate. This is like another now these days is a lot of research on that to see So maybe it can coordinate with the Chinese medicines, like the concepts into it. It sounds simple, but simples always can lead to like more complicated ways to do so. So like similarity between the interstitiums and the sun gels is that the fluid regulations mechanisms, as we talk about, uh, and that's it's integrates to fluid regulations, facilitating the movements and transformations of the body fluid, which is essentials for maintaining the homeostasis and supporting cellular functions across the tissues and role in the immune response. The both are like to contribute to immune functions by enable the transport of the immune cells and uh, monitors thereby the enhancing the body ability to respond to pathogens and maintains overall health. And interconnected physiological systems that's just like connects. So both are like connecting the whole body framework together, as we say. So the uh, historical contents of like of the Sanjiaos in Chinese medicines, the Sanjiao concept rooted ancient Chinese physiologies in facing holistic view of health and integrate physical emotions, no, and environmental factors, reflecting the interconnect of the body functions. Right, systems wise is unlike organs response. The Sanjiao's response of functional systems divided into three regions, each responsible for distinct physiological process and highlighting the dynamic interactions essentials for maintaining the health and the historical of the practice influence that understanding the Sanjiao has historical guide TCM practice, including acupunctures and dietary eluding in illustrating inducing the reference promoting balance of the wellness within the body. So that is the whole Chinese medicines. The Sanjiao theory has a whole like systems to deal with one of the way of approaching the treating all different kinds of disease. There's a different type of experts in Chinese medicines, like Sanjiao's um, experts will utilize that in developing the whole spectrum of the systems from like symptoms and diagnosis, the patterns and all that to treat the disease, which is I think is a little bit more complicated for non-TCM practitioners or like Western medicines practitioners that might not be able to kind of adapt the concept. But if you're interested, that is a whole new lines of the that theories can go in really deep, and it's a guideline to treat the disease as well. So how's that to implications for the modern medical? So the interstitiums classification as an organ necessitates a broader understanding of mathematical anatomical structures that challenging traditional definitions of encouraging a more inclusive perspective of body systems and their interrelationships. Impact of disease treatments. Um, recognizing that the role in fluid dynamics and immune response can lead to like different therapeutical strategies or like the treatment options of that. Integrations of medical disciplines, the interstitium's significance foster collaborations between Western medicines and traditional practice as TCM and promote holistic way approach to health and values the diverse methodologies and enhance the patient's care outcomes. So that is the way. But now I'm going to try to talk about TCM treatments for cancer treatments. Like things like Western medicine is like more like cancer is more targeting like cells or targeting like areas. So the key principles and approaches TCMs can take like holistic ways to focusing on maybe enhance the body naturals of defense, like boost it up the the immunities, the systems, the body constitutions, then restore the balance, the harmonies the within the body. So like from tuning up, like through the sun gels, the functions, and make it like processing what each gel is supposed to do, and that's kind of a domino effect to not make the bodies that either like can fight the cancer cells or can reduce the cancer cells like developing or mutations, and also like the alleviates the symptoms, the side effects of the modern like cancer treatments will have like no insomnia, low appetites, fatigue, or after the radiations or like chemotherapies, like have the pain, disease, and the low immune systems that can do. So, and overall can uh, improving the quality of life for the patients. So like common modalities that we use like to like herbal medicines, herbal formulas, and then to treat like, and there's herbs that for anti the tumor. There's herbs for like to kind of improve circulations. There's the herbs for boost the immune systems and or boost the digestive systems, make the patient absorb more. And basically, another thing is that the acupuncture that we use this a lot for treating like the complications and reducing chemo, the nauseating, the vomitings, and then to also radiations that's in the head cancer patients. So that's a couple of things that we do that into it. So overall, like Chinese medicines is back to it's all like this is maybe can like another ways of to think about the chi and the meridians. It is like the base of everything. So that's why there's some cancer patients or like they, after the cancer treatments might have like the meditations. You can find the balance. You make the chi all like like grounded, and that to find the balance of it. Okay, that's just the little bit kind of like go through the Chinese medicine sites, the concept, and try to kind of explain the interstitiums that to every of you guys. Hopefully that give you guys some, like start and think about or like inventing or research even more deeper to use that to help with the like cancer treatments in the future. All right. Any questions?
Thank you, Dr. Lee. If anyone have any questions, you can put them in the chat. We got a clap emoji. Uh, Dr. Lear has a question. Have there been any double-blinded studies using Sanjiao treatments in tandem with allopathic treatments for cancer? Great
Not yet.
question. Not yet.
Not yet. I think it's pretty new. I do some research. I only found to see that they are trying to using the sunshine approach to kind of treat like ovarian cancers, but I don't think like the paper is only like one or two, so probably it's pretty new.
Do you have
That's why
examples
when
of
when Dr. Witty like give me this topic, I said, "Oh my God,
Mhm.
this is kind of quite on the newer side."
No, that's great. That's what this forum is for. Thank you, Dr. Weir, for your question. Do you have patients in your practice that you do acupuncture on that do have cancer? And have you what are the outcomes that you've seen that have been helpful for them?
Mostly our patients, we don't directly treat a cancer. So
Hmm.
most of my patients, they come to me for after chemo, like therapy care or radiations. They come for neuropathy, they come for insomnia, they come
Hmm.
for pain, they come for want to boost immune systems, or they want to
Hmm.
boost it up before they go into like for chemotherapies and radiation therapies. Acupuncture wise is that we don't directly treat it. In Asia, we do have like mostly like herbal treatments for like cancer patients. That's but it's all like Western medicines, anti-cancer drugs, and also the anti-cancers herbal formula together, like both binomial treatments as one,
Hmm.
together. But in US, it's not quite because of the systems that cannot do
Mm.
that.
Hmm. Okay. Um, so Evelyn asks, she said, Happy New Year. Can acupuncture aid in addiction treatment, especially opioids and methamphetamines?
Yes, there's a protocol called NADA protocols that we do in the year. Uh, that is helping up to kind of addictions. That is to treat the addictions. Couple years ago, I was in teaching in the acupuncture school. Locally, we actually conduct the the addiction treatments in Waianae and Kailua
Mm.
sites, one of the addiction center, to help them like reduce the craving, and also that's kind of help them in like shorten the process, but that also work for reduce appetite. Appetite is a craving too.
I guess that goes back to the original question of acupuncture for weight loss. Taryn Lau asks, how would a practitioner be trained or educated in this field in reference to acupuncture?
Uh, I actually, so for locally, it's now the whole acupuncture profession is elevated to the doctorate program. So I believe it's like you have AA degrees, then you can go into the programs, and then it's a doctorate now. But in Asia, I was trained in Asia that we are same things. We like undergrads and then going to med school, and then 4 years of lecturing, then 1 year of internships, and like you rotations. In Asia, same thing that you rotate different stations, just like Queen's hospitals and all that. You have to roll different like specialties that to train Easterns and Westerns. That just our training. It's more like 70%, 60 to 70% of Chinese medicines, 40 to 30% of Western medicines. The teaching hospital, like in China, like our TCM training hospital, we actually it's a combinations. We do surgery too. We do like change hip replacements. We do all different stuff we have. And back to SARS time, I don't know everybody if it's know that remember that before the COVID, like a couple years back, like 2002 or 2003 or 4, that's a SARS, and that was in the hospital, like internship. So then that's just the times is that the people the all our treatments is all in high dose of a steroid, and this because they cannot control to bring the fever down. And our hospital actually is the hospitals that establish the herbal remedies to help out bring the fever down and reduce the usage of the steroid. And so that remedies actually go over all over the China to help out that situation.
Thank you. I guess a follow-up or a more in-depth question, can any practitioner be in acupuncture help with addiction treatment, or is it a special subset? Do you need more training to learn about the addiction portion?
I think it's every practitioner of acupuncture practitioners, they know all about it. It's not, I don't think you need a special training for that.
Okay. And then Dr. Gerald Coffey, he said, will most commercial insurance readily authorize or reimburse for non-Western treatments? Which treatments are routinely authorized? I guess you can share from your own experiences with your clinic or in general, your knowledge about what is reimbursed for non-Western treatments.
I mean, the acupuncture and now the commercial insurance locally, like HMSA, like they have HMSA and Kaiser, they have a underwriter through American Specialty Health that they cover the acupuncture treatment basically. And HMAA, UHA, they'll cover like acupuncture, only the acupuncture as well. And Medicare, now the Advantage Medicare, which is the Part C, like United Healthcare, AARP, like Humana, Devoted, they all cover like routine acupuncture as well. But the regular Medicare, the A and B, they cover acupuncture for lower back pain, but only for the uh, like the um, MD that with acupuncture training and license that can perform that. So other than that, like Cigna, that has the coverage, Aetna, and all that have cover acupuncture, and some cover like cupping or manual therapy. So that is right, some reimbursement, like we got in the clinic.
Perfect. Thank you everyone for your questions. Do we have any more questions from the audience? Or John, do you have any follow-up questions?
Dr. Lee, I was going to ask you, Dr. Withy is very actively involved in the medical education curriculum development at JABSOM. Are there opportunities for medical students and other medical learners, our residents and fellows, to maybe shadow or participate in some of the work you're doing and others in the community so they can
Sure.
kind of complement their Western medical education?
Yeah. That definitely. It's think like back couple years already is that I've been giving a talk with first year Jepson's future doctors
Mhm.
about acupuncturists. I've been doing that with Dr. Withy for a couple of years already. And it's always welcome to, shadows and like yeah, no problem.
That's very encouraging. Yeah, thank you again for all your support.
And Dr. Weir asked, could you give us a rough estimate of costs without insurance for various courses of treatment using acupuncture?
Okay. The price ranges are there like difference, like between like, practitioners and different yeah experience. But basically Um, as the like will be around for acupuncture section itself about from uh $80 to $120 per sections. Like that just the like I think it's the range of that in Hawaii or like California as well. And cupping is the difference like price range they basically differently. So but insurance yeah it's about like when the Medicare's rates is like depends on the code, how many codes they can build. It's about like 100 to 150, something like maybe to close to 180 per section. Depends on the
Thank
code.
you.
Yeah.